Hello again, Sepehr Lalezari here, general and bariatric surgeon based out of Los Angeles, California. Here to talk to you today about infection of the gallbladder, acute cholecystitis. Now, recently, Ruth Bader Ginsburg has been treated for an infection of her gallbladder at Johns Hopkins Hospital, where I did my training at. Now, what is an infection of the gallbladder? How do we get it? How does it come about? And how do we treat it? And the most common questions I get asked from my patients about a problem with your gallbladder. I'm going to address all these things in this video today. So, the gallbladder, what exactly is it? Now, the gallbladder is a sac that lives on the underside of the liver that essentially stores and concentrates bile. Bile is what helps you dissolve food. It's what helps you aid in digestion. It helps dissolve fats. Now, what the gallbladder does is it takes the bile that's produced by the liver, stores it, and concentrates it. Now, one of the common questions I get asked is, can we live without your gallbladder? And the answer is yes, absolutely. There's hundreds of thousands of people out there that have had their gallbladder removed. And if you absolutely can live without it. So now what happens without your gallbladder? Well, not much really. Your body adapts to not having it. And over time, it's essentially, you're like everybody else. Now, in the beginning parts of after you've had your gallbladder removed, you may experience some diarrhea if you eat fatty foods, and that will resolve in time. There's no good science out there to suggest that you need to avoid fats soon after you've had your gallbladder surgery. So I always put my patients on a regular diet, and I tell them though, if you develop diarrhea, avoid fatty foods. Other than that, you could eat whatever you like. But now, so an infection of the gallbladder, how does it come about? Well, the most common cause is from these things called gallstones. They're little cholesterol stones that form in the gallbladder from a dysregulation of cholesterol. So who gets it? Usually people in their 40s, usually people who are overweight, and usually females who are of childbearing, who are still childbearing. That's the most common person who gets gallstones, but it could happen to anybody. 30% of the population actually has gallstones, and they're walking around and they don't even know it. So it's a relatively common issue that's not necessarily a problem in and of itself. It becomes a problem when those stones block the ducts that lead from your gallbladder to the ducts that join the liver and go to your intestine. When this area is blocked, you have a backflow of the contents of the gallbladder that decreases the blood flow to the gallbladder, and that causes inflammation, and inflammation leads to infection. So that's how you get an infection in your gallbladder. Now, how do you treat it? Okay, and the treatment just depends on one, your medical condition, and overall what's going on in that time that you've gotten this issue with your gallbladder. So now there's three main treatments that you can undergo for an infection in your gallbladder due to gallstones. One is IV antibiotics. IV antibiotics can resolve an infection in your gallbladder. You don't necessarily have to have your gallbladder removed, although it's recommended, but having surgery has risks. So you need to discuss with your doctor and your surgeon about what are your risks for undergoing surgery. Now, a common question I get asked is it safe to perform surgery in the elderly, people above 80, like Ruth Bader Ginsburg, she's 87 years old. Is it safe to operate on a patient that age? The answer is, of course, but it just depends on their other medical conditions. One of the most important being the status of the heart. So now, you gotta make sure the heart can undergo anesthesia, the stress of surgery. And that's the most important thing, which needs to be evaluated before deciding to undergo surgery. If the heart is strong enough to withstand the stress of surgery and anesthesia, then it's absolutely safe to undergo surgery. Surgery most commonly nowadays is performed laparoscopically, minimally invasive, with small incisions and a camera and a couple instruments to do the work. Fast recovery, less pain, get you back to what you're doing quickly. The other way to do it is open, which is more painful, more stressful, associated with more complications. Now, if it's not safe to undergo surgery, what are your other options? Well, we talked about just treating with IV antibiotics and intravenous antibiotics. The alternative to that is to put a drain in the gallbladder, and our friends, the interventional radiologists, can't put a drain through the abdominal wall into the gallbladder to drain it, and that helps resolve that backlog of the gallbladder contents and helps resolve the infection. It lets the antibiotics do their work. So that's the other option. Now, another common question I get asked is, are there any homeopathic remedies? Are there any teas that I could take to resolve an infection of my gallbladder, to heal these stones? And the answer to that is no. These are not real. If you have an infection in your gallbladder, you need medical care by a medical doctor, an MD. Don't go to a homeopathic doctor. They cannot help you, and it's very dangerous. The thing that makes gallbladders very risky when you get an infection is that the gallbladder can burst. If the gallbladder bursts, the chance of dying from that infection is quite high. So you want to make sure that you're being cared for by the right people and you're getting the proper care. That's very important. Now, if you don't have a problem with your gallbladder and you want to try these remedies, these teas or whatever they're selling online, you can try it to get rid of your gallstones. Usually they won't work. But if you're part of the 30% of the population that's walking around with gallstones without an issue with them, you can try it and see if it helps you. But discuss it with your doctor first to make sure there's nothing in what you're doing that's detrimental to your health. If you like this video, please hit subscribe and like. Leave me a comment. Let me know what you liked or what you didn't like. If you want me to address anything else in a subsequent video, please let me know. Reach out to me on Instagram or Facebook. Here for your questions. As always, stay happy, stay healthy, and I'll see you next time.